I am Dr. Jaya Krishna. I practice at Agasthya Ayurveda clinic in Hyderabad, and in this episode we will try to cover some very commonly used fruits, out of which we will be starting with the banana fruit, which is commonly used all over India. In Ayurveda it is explained as Kadali Phalam. So, we will try to read the sloka, then we will go into the detailed aspects of that particular fruit. For example, in Ayurveda, Kadali, Varana, Mocha, Ambusara, Amshumati Phala, Mocha Phala, Swadushitam Vishtambi Kafakrit Guruhu, Snigdam Pittasra Triddaha, Kshatakshaya Samirajit, Pakvam Swadu Himam Pake, Swadu Vrishyancha Brahmanam. When an Ayurvedic doctor tries to explain anything about a particular diet or to be followed, or particular food or fruit or vegetable to be avoided, he goes according to the Shastra, because Shastra is the one from where he is getting the knowledge. So, as we see here, whatever has been explained, we will try to interpret it in very easily understandable language. He explains different types of synonyms for banana and then goes on to say that Swadushitam, first he describes the taste. It is sweet in taste. There are different types of varieties of banana. Everything has got a common taste, which is called the sweet taste. Ayurveda says that sweet taste has got a nourishing nature, a nutritive property, and it has got two doshas which it alleviates, or it is able to reduce that aggravation of particular two doshas, that is Vata Pitta doshas, Vata dosha and the Pitta dosha. And sweet taste has got the ability to increase or aggravate the Kapha dosha. So, when it comes to banana, Ayurveda says in cases of diseases because of Vata dosha, in diseases because of Pitta dosha, banana can be taken, but in cases of diseases which are related to Kapha dosha, Ayurveda advises not to take banana or consume banana. Here we will give you a few examples to understand in an easily understandable way what particular dosha is responsible for a particular disease. For example, if Kapha dosha is aggravated, Ayurveda says you will have hypothyroidism, you will have overweight problem, you will have obesity problem, you may have some problems related to your lungs, you may have some problems related to your sinuses. So, you may have suffering from bronchitis or asthma or pneumonia or sinusitis. In such conditions where your digestive system is not at the peak, where it is not able to digest easily, then you should avoid taking banana. If you are, there are some people who have got excessive appetite, so they feel hungry very quickly, and they would like to eat more frequently food rather than a normal individual. So, in that case banana is good for you, you can take it. And if your nutrition is less, if your weight is on the lower side, if you are emaciated, if you are having underweight problem, then you want to increase your weight, definitely you can take banana in sufficient quantity. Then Ayurveda says Snigdam Pitta Asra Triddaha Kshata Kshaya Samirajit Pakvam Swadu Himam Pake Swadu Vrishyanscha Brahmanam. In Ayurveda there is this concept called Brahmana and Langhana. In Ayurveda, if they say Brahmana, it means that it will help you in gaining weight. It is nutritive and it will help you in gaining weight. If it is said to be Langhana, then it will help you in reducing weight. So, nowadays everybody has the problem of overweight. So, banana consumption should be moderately done, or it should be taken at a less quantity. Snigdam Pittasra Triddaha. Triddaha means in case of thirst, in case of burning sensation, you can take banana. And Kshatakshaya Samirajit. In cases of diseases related to Vata dosha, there are 80 types of Vata related diseases, which starts from paralysis and it can go up to sciatica or cervical spondylitis or even back pain or lumbar spondylitis. In any of these conditions, you can take banana and it will act as a healer or nutritive in property. Next, we will go to one of the very commonly used available fruit, which is called pomegranate. This is called anar in Hindi and pomegranate in English. We will see the classical sloka what it says. Tattu swadu tridoshagnam triddaha jvaranashanam hritkanta mukhagandagnam tarpanam shukralam laghu kashayanurasam grahi snigdam medha balavaham swadvamlam deepanam ruchyam kinchit pittakaram laghu amlanta pitta janakam atyamlam vata kafapaham anamlam vata kafapaham. So, when we look at the sloka, what it says is, it is Tridoshagna. There is no barrier or there is no diet restriction or somebody should not take or somebody can take. There is nothing like that in regard to pomegranate. Anybody, irrespective of age, irrespective of any problem or disease, it can be consumed by everyone. So, if somebody comes to me with a fever or a loose motion or a oral ulcer or a gastric ulcer or overweight problem, underweight problem, any particular cases, we will advise you please take pomegranate. You can eat it, you can consume it in the form of juice also, no need to add any sugar or added sugar. Tridoshagnam, triddaha jvaranashanam, triddaha jvaranashanam. If you are suffering from any type of fever, it may be malaria, it may be typhoid, it may be tuberculosis, it may be because of you are having underlying bronchitis or a sinusitis. In any type of fever, this is okay, you can take it. Even if you are suffering from severe loose motions also, you can take it. If you are suffering from an irritable bowel syndrome, this is called a disease called a irritable bowel syndrome. What will happen in irritable bowel syndrome? When you have food, you will feel like running to the toilet because you will feel like your bowels are getting triggered. There may be loose motions, there may be sometimes mucus or blood present in the motions. This is called grahini in Ayurveda, where Ayurveda says that your absorptive capability has gone down. Your body is able to digest the food, but after that it has to absorb the food. That absorption happens through the villi or the intestinal villi, which gets damaged, and in that case this pomegranate acts like a nectar. In Ayurveda, we ask you to take it in a huge quantity. And I always tell to my patients who are having any type of heart diseases, it may be congestive cardiac failure or heart block or weakness in the heart or pumping capability has reduced. In that case, pomegranate can be used. If you see, it looks like its shape is like a heart, and when you look inside also it has 4 chambers, just like the human heart. It has 4 chambers, 2 auricles and 2 ventricles. Likewise, you will see the pomegranate also has 4 chambers. So, in case of anemia, where in Ayurveda we call it as pandu, there is a particular medicine which is prepared using this pomegranate, that is called Dadimadi Gridam. Then in particular loose motions, we prepare a medicine prepared out of the skin of the pomegranate, that is called Dadimastaka Churnam. So, it will help control the loose motions or the diarrhea. Hritkanta mukha gandagnam tarpanam shukralam laghu kashayanurasam grahi snigdam meda balavaham. So, children who are having problems with their brain, autism or hyperactivity or developmental abnormality, for them also it acts like a nectar. Swadhamlam deepanam ruchyam. If you don't have a proper appetite or proper taste, then also you can take pomegranate, easy to digest when compared to banana. This is easy to digest, that is guru, this is lagu. So there are huge differences in each fruit. This is what we are trying to convey to you through this episode.